county to level orange. That and because what I'm saying, this time next week, after a mitigation plan is put into place, we will be needing to move you to orange even after a mitigation plan. We have that, and we want to work with you and figure out what works best for your county. But the measures that should be taken place to really make sure that we can celebrate our winter holidays with loved ones, that we can have kiddos back in school in January, we have to start taking drastic measures so that way we can ensure that that happens.
I appreciate the situation there. You say 14 days. We've been in red for 4.
Correct.
And we've been in orange on capacity or incident rate for a longer period of time.
Correct.
Okay. And I know that if we go to level orange, we're looking at 25% capacity in many of these menus.
Correct.
And that is going to put us in a world of hurt economically in several of our Main Street businesses and others. And that's where quite frankly, I'm trying to advocate for them. As long as it's not a threat and a significant threat of increasing the spread. And that's why I said I'm going out personally and talking to these owners. But there's no point talking to them if all I can tell them is in a few days you are going to go to 25%, because they will close the doors. It's not a threat, it's just their economic reality.
Are there other mitigation efforts, Dr. Bencoli, that you would consider doing?
So specifically, while I was talking with Michelle Child, I was really advocating that we're doing a great job doing our outreach, doing our public health mitigation measures, ensuring that a lot of PPEs are being distributed at different places, making sure that we contact trace and then we implement quarantine and prompt isolation when cases are detected. We even have set aside specific qualitative testing and other testing for COVID to identify easily people that may be positive. So on the spectrum of preventive measures and mitigation, we have been doing a lot of that. And that is why you see that our positivity rate has not been rising in concurrence with the incident rate, which will actually really measure up if the outbreaks and the infection sources are within our county. So that was what informed my asking that if we can give an exemption around the capacity clauses while we continue to ramp up our prevention and mitigation measures, we will be good. I even had this impression that if efforts should be targeted towards the surrounding counties where we have the outbreaks coming from, I tell you, we'll be doing really good, because if you get to the source, then it's not going to be spreading to us. So we are ramping up. As I'm telling you now, we've already gotten 400 curative testing kits, and we're also bringing other folks that will come and do community testing within our county. And all county facilities, all the entrances are going to be having enhanced presence of hand sanitizers. And we're going to be, instituting and even enhancing our 6 feet office spacing. I mean, all these were all put up in my mitigation plan to make sure that our public health mitigation plan is really increased. But
are there capacity restrictions in your mitigation plan?
But I did make a request because, the chairman has already made a clear-cut explanation on the economic reasons and the community perception. It's going to really hurt us if we clamp down on a capacity that is already at 50% and they are struggling right now. I feel if we continue with our public health mitigation plan, ensuring people wear masks, people wash their hands and use their hand sanitizers and their spacing, we can manage that. We can manage the capacity, even at yellow, And if CDPHE can make every effort to really deal with where the sources are coming from, especially from the surrounding counties, Alamosa, Casillas. If the source is dealt with, we'll be fine. So, the perception in the community is very, very strong as per this. If we go further in clamping down the capacity, you know what, we might even be losing our efforts on the prevention part. So I'm kind of like advocating and really asking for a midline here where, we can continue with the public health, enhanced mitigation measures. At the same time, people can still know and see that we are listening to them, and they will really be able to listen to whatever we say. So I don't know how well I could say it, but we're doing very well on our mitigation plan, enhancing our public health measures, increasing facial covering places, increasing sanitation and washing of our hands. We're doing everything possible. That's why you are not seeing outbreaks coming up from our own county. But that capacity thing is going to cause a lot of problems for us. And that's what I've been advocating, and I advocated with Michelle. And hopefully you're going to look at it pretty well along that line.
No, and I can appreciate that, sir. So I guess where I was coming from with capacity were restrictions on indoor and outdoor events where people are gathering together. That is our concern, is the mixing of households. And have you looked at that in terms of your mitigation plan of reducing folks that can socialize together?
I'm coming here as a layperson, okay? So if you'll indulge me, there was some confusion on public gatherings, and we understand limited to a certain number and say only 2 family units in a gathering. And the question became, well, let's just pick a obvious public gathering type of thing, places of worship, which seem to have a slightly different restriction in terms of the 2 family thing and that. So we had some confusion around that. As far as indoor and outdoor gatherings right now going on in the counties, we don't have anything major on the books, do we? There's nothing out there proposed in terms of group gatherings and what have you. The schools, Ida, our COVID response coordinator, and Dr. Bancola have been working closely with whatever's happening at the school, and I understand several of them have gone to remote learning now and may stay that way until the first of the year. Is that correct?
Some were even closed
till the end of the month.
But
we're paying very close attention to that. But I don't want to seem disingenuous or vague. We are unaware of any major gathering, and so what we're looking at is things like the places of worship and the capacities there, as opposed to the restrictions on, say, public gatherings. I guess I was looking for clarification on a definition there. And I can't think of anything else except for restaurants, the retail businesses, and the potential of ramping up to more curbside delivery and things of that nature, I believe is doable. I've talked to several of our small shops and Main Street businesses in Monte Vista specifically, who are willing to work together with us to try to keep that going. And I'm going around personally, again, not that I'm that important a person to these people, but I'm taking signs. I'm taking the state signs to them saying, you put this on the door and then enforce it, because we have to. Simply, we have to do that. So that's it, I guess. And so it's a long way of coming back to the question of indoor and outdoor gatherings, and I don't even know if I addressed your question. I'm sorry.
I appreciate that. And I'm not sure if you did, but that's okay. No worries. Dr. Pangoli, have you submitted your mitigation plan to Elle yet?
Oh, yes, I did last week, and we reviewed it again this week. Okay. And that was why I made my, I was advocating for exemption, but I was waiting for today's meeting where we can all rub minds and then see how, if there's going to be a need for me to make modifications to my mitigation plan going forward, then I would do so.
So we would really need to see the indoor and outdoor event gathering sizes in line with Orange. So it's 25 indoors, outdoor events of 75, because we just want to really stress the messaging that folks should not be mixing with other households. That's something that we are very concerned about. Really, compliance with mask wearing is something that's very important. I'm looking at the video right now, and I don't see many masks, and so that would concern me, and I would want to make sure, thank you, sir, that we're wearing masks, because that we have definitely seen an increase of with mask wearing, the disease transmission decreases, and that's really important to us. And so let me work with Elle, and we'll write a letter back about your mitigation plan and what next steps will be.
Oh, okay. So I don't need to do anything yet until I receive that letter from you guys.
Yes.
Okay.
We will have a response to your letter and if we'll and what that will look like. But in that letter, it will require certain level orange capacity limits. So that way we can, and not necessarily on your retail or restaurants, but specifically on indoor and outdoor events. And then I would highly encourage you thinking about an earlier last call as well. We have seen an improvement with that. And then all of your bars should be closed if they're not operating as a restaurant.
I think if we can reach that level of compromise, I believe that's something that we can present comfortably to our community. And we would certainly work with that. I apologize for not wearing the mask. I'm kind of a lip reader. Now, people don't have to read my lips, but I'm a bit of a lip reader, and I do have some trouble with the breathing through the mask. So we're setting quite a ways apart. We could put a tape measure out, I guess, to hopefully increase your comfort level. But anyhow, that's where we are, and we're doing our best in here. And Dr. Bancola is clamping down on the courthouse. I won't say he's monitoring the halls, but he's definitely making a point of letting us know that we have to behave ourselves.
Well, thank you everybody for your time. We'll be in touch with what the letter will have and next steps. And I'd like to set up another follow-up call for the week after Thanksgiving, maybe the 30th or 1st. And so that way we can follow up and make sure that the next steps are clear for everybody. So
thank you so much. It's a pleasure to meet you, Mara.
Take care.
Thank you. Thank you, Mara.
Thank you. So basically, we're in the same. We're still on. Are you ready to end the meeting?
No, I mean,
but we're still on. Yes.
We're still
As long as we're meeting, we're on the record.
right.
I mean, with CDPHE is what I'm saying.
CDPHE is no, they have left.
Okay, so if we're still on, I mean, with the community, I mean, it's a good recognition of the fact that we'll listen to the community, we are advocating for them within the scientific practice of public health, and at the same time, finding a middle ground so that, we can marry science with perception on ground, at the same time be able to live our life the way it should be. So right now, we're still in the yellow until we get a letter of clarification. And after the second meeting, then they will declare whatever they want to declare based on that.
So it'll be after Thanksgiving.
Yes.
That we'll get an official decision on this. Technically, we're in the red on the incident rate.
Yes.
However, they're willing to work with us at this point, and we will have letters exchanged and a phone conference with CDPHE the first week after Thanksgiving. Until this time, for anybody that's watching this, we're still at level yellow. Okay.
And I will say for whoever is also watching, please maintain all the public health measures. Wash your hands frequently, maintain 6 feet distancing between non-household community members, and wear your mask. Mask works.
Thank you. Are there any questions or comments from the rest of the audience?
And I guess there is a potential that, because that's over a week, 10 days till we would get our letter, there is a potential that we could go down in level. And by that point, possibly, hopefully, be able to maintain that. correct?
You know, the funny thing is, the thing is
I'm
that,
getting some really
yeah, it may not be because
not believed looks from the back of the room.
this thing is not happening in our county per se, where it's coming from outside. If you don't have control of the outside, we cannot say that.
But if we, the thing I think I would like to emphasize, and you've emphasized it, it's been emphasized here, we need to do our part. Wearing a mask is not a political statement. Okay? And if we are going to have any success at all in keeping our county open to the maximum extent possible, everybody's going to have to play the game with us. Help us out so we can make this argument. So for the restaurants, put the signs up that require a mask on entrance. Have your staff wear their mask. For retail, the same thing. Do everything you can to help us so we can help you and help this county and keep these businesses open. Is there anything else?
I'll tell you, the restaurants in the county that I've been to, and I try to get in and out of them pretty regular. I've never been in one in our county that I haven't seen them have that sign up and you have to wear a mask on. So the ones that may try to get away with it, don't.
Is there anything else?
I just want to publicly let everyone know this new public health director is here to serve the community. We are here to listen to you. We're also here to make sure that science and community work together. And that is the approach I'm going to be taking. Like the chair says, it's not a political statement. We all got our life to live. We all got to improve our health and well-being. These are unprecedented times. These are really great times to, to lead both with the heart and also with the head. We marry the two together. Thank you, everyone.
Thank you.
Thank you, Doc.
Thank you.
Okay. We're effectively accomplished all the business for this meeting. Is that correct?
Yeah.
I'll entertain a motion to adjourn.
So moved.
Second.
Motion second. All in favor?
Aye.
Aye. Arr. Punch us out of here.
Arr.
All right, ending the meeting.
John, when I came in, why were you not smiling?